Welcome, and again, good morning. Welcome to the next installment of the Return to Work webinar series. Today, we will be focusing specifically on vaccines and employer policies, doing a deep dive and a follow-up to our session from a few weeks back, where it's going to be featuring our friends at Wilson Sonsini as well as 650. Again, any of the information that we're going to be covering today is current as of today, and we strongly recommend that before making any decision on a policy approach or a solution that you would trust, that you reach out and confirm with a trusted advisor or your general counsel. Today's agenda, we're going to jump into, again, a deep dive into COVID-19 vaccine policies and different considerations you may want to take from an employer perspective. We'll provide a quick update regarding COVID-19 testing from the FDA, and then we'll turn our attention to how to actually generate a vaccine policy for your organization, and then tracking vaccines that your employees are having administered within the Sequoia Return to Work Center solution. We'll round out our time together with a Q&A and some closing remarks. But before we jump into today's content, I wanted to provide a few quick announcements. My name is Jonathan Moore, the Director of Product Marketing at Sequoia, and I'm filling in for Michele Floriani today. Before we get started, again, you'll have a little Q&A icon in your Zoom menu. Should you have questions along the way, please feel free to use that Q&A button, and we'll do our best to respond to those questions over the course of this webinar. For any of those questions that we're unable to address today, we'll be sure to fold it into a future webinar session. Any of these sessions are being recorded. You can review them after the fact at sequoia.com/events. And there's also going to be CLE credits available for any attorneys listening in. You'll find out more in tomorrow's follow-up email. Next, we're excited to announce our annual conference, The Grove, is coming to a screen near you on March 4th, so only in a few weeks, and registration is now open at sequoia.com/thegrove. We're really excited to announce our keynote speaker this year is Josh Burson, an HR expert and researcher, and he'll be walking us through trends that he's seeing in HR for organizations over the next year and beyond. We'll also have a range of different sessions to participate in, like how to craft the DE&I strategy for your organization. We'll also have a community of different vendors and point solutions that are really vetted by our community and are best-in-class tools to approach the various challenges that we're all facing in today's environment. And lastly, we'll round it out with development updates and our roadmap for the Sequoia People platform and the product experiences on top of it. Again, the Grove event is going to be on March 4th in a few weeks, and you can RSVP at sequoia.com/thegrove. Today, you'll also have a preview at the Sequoia Return to Work Center solution, which is really helping companies navigate returning back to the office, whether for their essential workers with employee cohorts or ad hoc requests to come into the office with reservations. And what's inspiring about the Return to Work Center isn't the software or the tool that exists, it's how we're seeing companies use it. Over the last 6 months, we've seen over 60 companies, nearly 30,000 employees leveraging the Return to Work Center to safely return to the office. That's in over 130 international cities. And what's really exciting is making sure that employees feel safe when they come to the office, again, whether they have to or whether they need a break from working from home. We also are creating a ton of resources available to all of you on our website at sequoia.com/RTW. We've launched a refresh webpage this morning, actually, complete with resources curated from our community of clients and partners and thought leaders, curating them into pulse surveys and insight reports, from managing a distributed workforce to even thinking about strategies to supporting employees that have families and have kids next to them doing distance learning at the same time they're on a Zoom call. So be on the lookout for resources available there. And we're excited to announce next week our next pulse survey specifically for the topic we'll be covering today of vaccinations and employer policies will be released to sequoia.com/resources next week. And lastly, we've created weekly roundtables, which are intimate gatherings among our clients to really share ideas, experiences, and ask questions in a more intimate setting with fellow colleagues in the HR space to really inform the return back to the office and the different challenges and solutions that companies are facing and implementing in today's environment. You can register for any of those roundtables again at sequoia.com/events. So enough about updates. Let's jump into today's content. Vaccines and employer policies. I'm excited to say that this is the 14th installment of our Return to Work webinar series, and we've been so thankful for not only the content that you have asked us to really cover from a topical perspective, but also the partnerships and the thought leaders that have joined us every step of the way. Again, today's session is a follow-up and a deep dive into the session we had a few weeks back on vaccinations and COVID legislation. Today's guest presenters, we have our friends from Wilson Sonsini, Marina Satalis, and Eva Yin, as well as Kimball Parker, the CEO of 650, walking us through his policy generation engine, and Landon Hirsch from the Sequoia team, showing how the Return to Work Center can help manage tracking employees' vaccinations and coming back into the office. So without further ado, I'd love to hand it over to Marina.
Hi, everyone. I'm Marina Satalis, and I am the head of the employment law practice at Wilson Sonsini. I'm delighted to be back today to talk with you in some more detail with regard to COVID-19 vaccine policies and considerations from an employment law perspective. So as employers, you can start to plan what your policy will be and how you'll handle exceptions and other issues that are likely to arise as you think about the issues of employee vaccinations. So as we go to our first slide, we talked about this previously, but just for those of us who were not with us, or to reorient those who were, can employers impose a mandatory vaccine policy? It's a question that we get a lot, and it'll continue to be a lively question, I think, from our client base and others. And thankfully, the EEOC issued guidance on December 16th, 2020, to address questions about the COVID-19 vaccine. And as part of that guidance, the EEOC made clear that employers can mandate that employees receive the vaccination as a condition of working on site. So the answer is yes. I mean, there certainly are exceptions and limitations, which we'll discuss in today's presentation. But the EEOC has made clear that private employers can, in fact, mandate the vaccination for their workforce as a condition of working on site. And it's provided that if an employee does not comply, if somebody says, I don't want the vaccine or I can't have the vaccine, the employer has to engage in an individualized analysis with regard to that particular employee as to whether an exception is in order to your mandatory vaccine policy, whether that's to provide a reasonable accommodation due to a disability or an accommodation that's necessary for purposes of a sincerely held religious belief or some other reason. But those are the two big exceptions, and we'll talk more about them later. I'll say also that this is not the first time that a federal agency has made clear that private employers can mandate vaccination of their employees. Back in 2009, when we were dealing with H1N1 influenza A, which was a pandemic influenza virus, OSHA made clear at that time that although OSHA did not specifically require that employees be vaccinated, employers could do so. Employers were able at that time to mandate vaccinations for purposes of that pandemic influenza virus, and they can now with respect to COVID-19. Now, it'll likely be several more months before the vaccine is widely available to all of us, to all Americans. And the EEOC and other agencies may very well come out with additional guidance, and they may revise the guidance that they've put out as things change, as we get more information about whether people who are vaccinated can be carriers, about the efficacy of the vaccine, and as more and more people in critical masses are vaccinated. But it's not too early, certainly, to think about what your policy will be with regard to the vaccination of employees and to prepare for how you'll handle the vaccine in the workplace. I'll also say, as we round out this slide, that the EEOC guidance also made clear that it is lawful for an employer to request proof of vaccination, because requesting proof is not likely to elicit information about a disability, simply asking if someone's been vaccinated or not. But the guidance does caution that subsequent questions like, why haven't you been vaccinated, that may get into some disability-related issues would be subject to the pertinent standard under the ADA, the Americans with Disabilities Act, which is that any such questions about medical condition or disability of an employee must be, as the slide says, job-related and consistent with business necessity. And we'll talk about that a little bit more as well. On the next slide, we talk about the first big exception to, I said, yes, You can mandate the vaccine, but there are some exceptions. This is a big exception. This is the disability exception. So the ADA generally prohibits an employer from requiring a medical examination or making inquiries about an employee's disability unless that medical examination or those inquiries are job related and consistent with business necessity, as I mentioned. And if an employee indicates that they're unable to receive the vaccine because of a disability, the question becomes, well, you just said I can't ask questions about a disability or a medical condition unless it's job related and consistent with business necessity. So what do I do? How do I undertake that individualized assessment to see if I need to make an exception to my mandatory vaccine policy? Happily, the EEOC has laid it out in that December 2020 guidance, as I mentioned. The first question that an employer then needs to ask as they undertake this individualized assessment, this employee said they can't be vaccinated because they have a disability. Here's what I have to do as an employer. I have to ask myself, would the unvaccinated employee pose a direct threat because of a significant risk of substantial harm to the health and safety of the individual or others? That's the first question that an employer is to ask in those circumstances and consider. So, there are two considerations there. There is the health and safety of the individual and the health and safety of others to take into account. And the EEOC in its guidance said, when you're considering this first issue, the individualized assessment, you're to consider four factors: the duration of the risk, the nature and severity of the potential harm, the likelihood that potential harm will occur, and the imminence of the potential harm. The EEOC also said that a conclusion that there is a direct threat posed by this unvaccinated employee would include a determination that the unvaccinated employee will expose others to the virus at the workplace. So the question becomes, as I look at this factor and I think, does this person pose a direct threat to the health and safety of the individual or others? Well, who is the individual? Is this unvaccinated employee particularly susceptible to severe complications if they were to contract the coronavirus? Are they older? Are they immunocompromised in some sense? Do they have some other medical condition that might make them particularly susceptible to a severe consequence as a result of infection with COVID-19? Who are the others? Is the rest of my workforce vaccinated? Is this the only person, for example? And then how much of a risk do they pose to others in the workforce if everyone else is vaccinated? Or is it a large group of people who don't want to be vaccinated for one reason or another? And now perhaps the risk calculation is different. Others also includes non-employees. So is this employee customer facing? Are they, for example, interacting with patients or other high-risk individuals? So it really is an individualized assessment of what is the danger of permitting this unvaccinated person in the workplace, and do they pose a significant risk of substantial harm to themselves and to others, and others goes beyond the other employees. Two, if so, if those are my circumstances, can I as an employer provide a reasonable accommodation which is limited by undue hardship? So I don't have to do something that would be an undue hardship. But to that point, is there a reasonable accommodation I can provide that would either eliminate or reduce the risk so that the unvaccinated employee does not pose a direct threat of significant risk of substantial harm to themselves or to others? And so again, an individualized assessment. What reasonable accommodations might be appropriate here? Can I change the work schedule? Is there certain PPE that would work? Can I change a particular office location? So the person still needs to be able to perform the essential functions of their job. You don't need to take those away. But are there reasonable accommodations by which the person would still perform the essential functions of their job, but I've now either reduced or eliminated the risk of substantial harm? And three, if the answer to that is no, my employee is an aide in a rehab facility working with patients with respiratory issues. That was the most extreme example I could think of. So in that circumstance, the person probably can't work remotely. And none of the things I talked about by way of work schedule, office location, or even maybe PPE can reduce the risk to an acceptable level where that person does not pose a substantial risk of harm to the patient population, for example. So if If you're in a circumstance where the answer is no and you're on prong 3, the employee can be excluded from the workplace, but still not necessarily terminated. So now they can't come to work because they can't be vaccinated, but you still have to undertake an analysis and think, well, can they perform the work remotely? So before you get to termination, we need to consider that step as well. These steps really do require an employer to know how to recognize an accommodation request from an employee with a disability, to know who to refer it to for consideration, and to understand really the need to engage in a flexible, interactive discussion to go through these factors and figure out where you land on the disability issue. And on the next slide, we'll talk about the other big exception, which is the religious exception. So if an employee indicates that he or she is unable to receive the vaccination because of his sincerely held religious practice or belief, again, that triggers an accommodation obligation on the part of the employer. You may have to bend your mandatory vaccine policy to accommodate this person. And I said last time, but I think it bears repeating, that this is a very broad exception. A sincerely held but non-religious opposition to vaccination is legally insufficient. An employee has to demonstrate that their objection to the vaccine is based on a genuine religious belief. That said, what is a religious practice or belief is defined very broadly to include not only traditional organized religions, but also religious beliefs that are new, uncommon, not part of a formal church or sect, only subscribed to by a small number of people, or that seem illogical or unreasonable to others. An employee's belief or practice can also be deemed to be religious under Title VII, even if the employee is affiliated with a group that does not espouse or even recognize that individual's belief or practice, or if few or no other people adhere to it. So very broad exception. And I imagine that some employees will try and fit into this exception because it is very broad, where they don't want to be vaccinated for one reason or another. The EEOC has also said that the employer should assume that an employee's request for religious accommodation is based on a sincerely held religious belief. In other words, it'll be an uphill battle to try and challenge whether a person has a sincerely held religious belief or practice. So if you're in that circumstance and somebody claims that and you believe that they fit the bill in terms of the religious exception, again, you have to think about whether there is a reasonable accommodation that would enable this person to perform the essential functions of their job without posing an undue risk of substantial harm to other employees. And undue hardship in this context under Title VII is having more than a de minimis cost or burden on the employer. Potential accommodations are the same kinds of things that we talked about, and we'll talk about accommodations again in the next slide. So there are other limitations. An employee who is not disabled and does not have a religious basis for refusing the vaccine may be excluded from the workplace in accordance with a proper mandatory vaccination policy. But, because there's always a but, there are some limitations here. So if you were to take an adverse employment action against an employee who, for example, is pregnant or fits into another protected category, there could be a disparate impact claim. In other words, those employees could have a case to say that your facially neutral policy, your mandatory vaccination policy, disparately impacts us, this particular protected group, and there's no business necessity for it. So there is a potential claim of disparate impact on certain protected groups. In addition, employees who suffer adverse employment actions for refusing to be vaccinated, in other words, they're terminated or demoted or something bad happens to them in connection with their employment because they refuse the vaccination, may have a claim for wrongful discharge in violation of public policy based on the emergency use authorization law. So right now, the vaccines are given out under this emergency use authorization. And under that grant, the EUA grant, the FDA has certain obligations. And one of those obligations is that people who are getting the vaccine have to have an option to accept or refuse the vaccine. And so employees could rely on that as the public policy serving as the foundation for a wrongful termination claim if, for example, they're terminated because they refuse the vaccine. On the next slide, accommodations and other safety protocols. I had mentioned that we would get a little more deeply into what kinds of accommodations are available to employees who are entitled to an accommodation, either for purposes of a disability or a sincerely held religious belief or practice. And these are some of the things we mentioned: telework, that is working from home, remote work, face coverings and additional PPE, adjusting their duties, modifying schedules. But again, they have to be able to perform the essential functions of their job. So it's not like changing the fundamental function of the job is something that is available or necessary for purposes of the accommodation obligation. The obligation is to, as we said before, engage in this interactive process and figure out what might fit in the circumstance to try and find ways to eliminate or reduce the risk that the employee would pose to themselves or others to an acceptable level. And according to OSHA, I also wanted to mention, employees who are vaccinated, even employees who are vaccinated, must continue to wear face coverings and remain physically distant, because there is no evidence, at least at this point, that the vaccine prevents transmission of the virus from person to person, that you would be so-called be a carrier. And that's part of all of this analysis as we think about the harms to people and to others as a result of unvaccinated employees. So on our next slide, I also wanted to touch on who should administer the vaccine. If the employer themselves or administers the vaccine, or they get a contractor to come and do it on their behalf, you have to show that the pre-screening questions that are necessary before you give someone the vaccine, because they are related to a medical condition or disability, are job related and consistent with business necessity. So there's that risk, an additional risk, if the employer themselves administers the vaccine. There are two circumstances in which disability-related screening questions can be asked without that worry, and that is in connection with a voluntary program. An employer that puts out a voluntary immunization program and gives the vaccine themselves, but only on a voluntary basis, means the pre-screening questions are voluntary too. And as long as employees don't suffer any adverse employment action or for refusing to answer them, you don't have the same ADA concern. And of course, third-party administration, telling employees, for example, you need to be vaccinated, but go get it through your doctor or a pharmacy or somewhere outside the employer. Our next slide, asking for verification of vaccination. Employers can request proof of receipt of a COVID-19 vaccination. The ADA made that crystal clear in its guidance. However, because it can be medical information, you have to keep it confidential, just as you would with any other medical information. We talked before about being cautious about making inquiries that could implicate the ADA standard. For example, well, why didn't you get the vaccination? Back to the analysis we talked about, which is that's a disability-related question. It has to be job-related and consistent with business necessity. And of course, you can't retaliate against employees who are unable to be vaccinated due to a disability or religious belief. We've included here a form to the right, which I think Kimball might get into later in this presentation, which is a way to ascertain whether employees have received the vaccine. It's yes or no, but if it's no, the only questions we ask is it due to a disability, without asking what the disability is it due to a sincerely held religious belief, or is it due to other? And only in the case of other would there be an explanation. So next slide. I wanted to touch very briefly on the benefits of a voluntary vaccination program, which seems to be where more of our clients are headed. It avoids the ADA standard on pre-screening inquiries. The employer may be unable to impose a mandatory program on unionized workers. If you have a segment of your workforce that is unionized, that collective bargaining agreement may limit what the employer can impose on a mandatory basis. It allows you to avoid consideration of accommodation obligations, and you avoid disciplinary action for employees who refuse to be vaccinated. And if you look at the poll figures in the green box here, there could be very substantial numbers of workers who actually end up refusing to get the vaccine And that will lead employers to some difficult decisions if a large component of their workforce is unwilling to get it. Many of our clients, and I see and I read about many companies are offering incentives to encourage vaccination of their employees, whether it's a monetary benefit or paying for their lift in order to get to the vaccine site, paying a portion of their health insurance premiums. There are all kinds of incentives that you can read about that Target and Tyson Foods and lots of other hospitals and employers are offering to encourage people to be vaccinated. And finally, the last slide here is just there's the CDC, we provide a link there, recommends that employers educate their workers about the COVID-19 vaccine. And you're welcome to click on that link for some helpful information that you could share with your workforce. And with that, we have a summary of takeaways that we can go through. And it's just really what we talked about, summarizing the points that we raised here. And I'm happy to take questions as well as we go forward.
Awesome. Thank you so much for walking us through that. We'll hold our Q&A session toward the end of today's webinar. And I'd love to introduce Eva Yin from Wilson Sonsini as well to give us an update regarding COVID-19 testing. Eva, to you.
Thank you, Jonathan, and thank you, Marina. Hi, everyone. So my name is Eva Yin, and I am an associate in the FDA and Healthcare Regulatory Group at Wilson. So this slide shows the two different categories, the main categories of tests that are currently available on the market. So the diagnostic tests are those that are designed to detect parts of the virus. And these types of tests are what you want to use for screening purposes. And the other category is the serology antibody test. So these tests are designed to detect antibodies generated by the immune system in response to exposure to the virus. And so this is really detection of the antibodies after exposure. And these types of tests should not be used for diagnostic purposes or to exclude an active infection. And the way these types of diagnostic tests come to the market is through the emergency use authorization, or the EUA. And this is an expedited process by which FDA reviews the validation data and also clinical data that manufacturers submit for the intended use of their product. And FDA reviews that data before they grant the EUA. And this is not as extensive as the conventional FDA approval or regulatory or clearance process. But nonetheless, FDA does review the data and the validation before they grant EUAs. And that's what you want to pay attention to when you're considering which type of test to use. And as of earlier this week, there have been over 300 tests and also sample collection kits authorized by FDA. So the first one I'll discuss, and this is quite a milestone for FDA and also for the US national testing effort. And this is the first and also the only to date a fully at-home diagnostic test that doesn't require a prescription, and it's authorized for home use. And I've also excerpted the language from the EUA so that you can see the language that the indication that FDA has authorized. So this is a test that's manufactured by Ellume. They're based in Australia, and here you can see that a prescription is not required, and it's a nasal swab and can be self-collected. There are age restrictions, and importantly, this is authorized for those with or without symptoms. The next slide, as you can see, on February 1st, the DoD announced that they have signed a very large contract with Ellume to increase the domestic production of the Ellume at-home test. And the government aims to procure 8.5 million tests to be distributed across the US. So this is a very important test for US national testing strategy. Next slide provides another example of a test that's authorized by FDA for direct-to-consumer home collection kit. And this is the Pixel home collection kit marketed by LabCorp. And here, as you can see, It's authorized for home use, and one can self-collect. There is age restrictions. You have to be an adult in order to collect a nasal swab, and it is authorized for those without symptoms as well. And basically, anyone can go onto the website to order the Pixel home collection kit, and then you collect the nasal swab and you send it back to the lab, and LabCorp then analyze the sample, and then you can get your results through their online portal. And the next slide. And here I also highlight this home collection kit because it's currently available on Amazon. And this uses a saliva at-home collection kit. And as you can see in the EUA language, this does require a healthcare professional. And this is part of the online registration to use this sample collection kit. So that's one thing to keep in mind, that this is different than the Pixel one, where a healthcare professional is not needed. Next slide. So here is another example of an all-in-one test that FDA has authorized. And this is the Lucira test. And here, as you can see, a prescription is required. And also there's it's for self-collecting a nasal sample and for use at home. And on the next slide here, this is the Abbott antigen card home test. And I provide this as example to highlight some of the restrictions that FDA can impose on these types of tests, because not every at-home test is equal. And as you can see here, FDA requires a prescription for this to be used at home. And importantly, FDA has authorized this for use within the first 7 days of symptom onset. So this is a test that would not be appropriate when you're screening mostly, if not all, asymptomatic individuals. And also to perform the test, it requires a supervision of a telehealth proctor. So that's something to keep in mind when you're selecting different tests to use for the screening program, where you're really screening mostly asymptomatic individuals. And the concern is that if the test hasn't been properly validated for asymptomatic individuals who tend to have lower levels of the virus, then the test may not be sensitive enough to detect and to really work for the purpose of screening. And the last slide, just to sort of summarize some of the key considerations that you want to think about as you're designing and implementing your screening program. One, you want to take a look at the EUA language that FDA has granted, and you want to pay attention to the indication language, and you also want to make sure that the test has been validated for asymptomatic individuals. And you want to check if the prescription is required. If it is required, then you want to work with the test service provider to make sure that there is a qualified healthcare professional available to provide the prescription or to supervise the sample collection. And you also want to consider if this is all in one test or if this requires a lab to process the sample, because that will impact the timing of the test result. And you also want to make sure you have informed consent in place before employees submit their samples for screening. And you also want to consider working with the service provider to make sure that they have the capabilities to report the required data to public health authorities. So this concludes my section of the slides. I'm happy to take questions at the end of the presentation. Thank you for your attention, and I'll turn it back to Jonathan.
Wonderful. Thank you, Eva, for walking us through those updates regarding COVID-19 tests. So now, whether you're thinking about a voluntary vaccination policy or even testing policy for your organization, or one that's mandatory, I'd like to turn it over to our friend Kimball at 650 to walk us through policy generation, specifically in the context of a vaccination policy for your organization, and how to craft it using the 650 tool. Kimball.
Hey, thank you very much. As you can tell from this presentation and from listening to Marina and Eva's comments, this is a very complicated area of law. There's a standard, there are exceptions to the standard and exceptions to the exceptions. And so everybody would love to have Marina, for example, on their team, helping them craft a vaccine strategy and a vaccine policy And so what we've done is we worked with Marina basically to teach our automation system how to draft, we taught the automation system how to draft a vaccine policy just like Marina would. And that vaccine policy module is included in the return to work offering through Sequoia. And so I'm going to show that to you right now. Basically, you once you're in your dashboard, you can see there's a little vaccine module here to the left. If you click vaccine and go to vaccine policy here, you can click new document. And so what this is going to do is it's going to ask you some questions. It's the same questions roughly that Marina would ask. And as you're answering those questions, our backend system is adding in paragraphs, taking paragraphs out, and adjusting the paragraphs just like a lawyer would as that lawyer drafts a document. So you can click new document here. The questions here appear on the left in a queue. And depending on how you answer some of these questions, more questions will appear. So for a vaccine policy, really the biggest question you have is, are you going to make this policy mandatory or are you going to make it voluntary? And depending on your answer, then this system will follow up with some additional questions. So let's say voluntary. And then it'll ask, okay, would you want to give your employees a financial incentive to be vaccinated since it's voluntary? Yes or no? Let's click yes. Then it'll kind of follow up and ask, okay, so what type of incentive do you want? When you're done answering all these questions, then you can download your policy. And so I before this presentation created two policies that I want to show you. One is a mandatory policy, and the other is a voluntary policy. So I'm going to show you the mandatory policy first. Okay. You can see it's a full page of policy language. And then the second page has a vaccination verification form. And this is one of the things that that Marina kind of showed on her visual about asking, okay, have you received it? And if not, why? A disability, please do not disclose your disability, or do you have a sincerely held religious belief, and others. So this takes into account kind of all the best thinking with regard to the EEOC's guidance there. Here is a voluntary policy. So if you have a voluntary policy, you don't need that type of end form to have people verify that they've been vaccinated. And so again, depending on how you answer questions, we're adding information in, we're taking it out, and we are adjusting it just like Marina would. Now, once you have this policy, I'm now going to hand the time over to Landon, and Landon's going to talk about how you can take this policy, put it into Sequoia system, and then share it with your employees.
Thank you, Kimball. I appreciate it. And I am going to segue that into within the Sequoia Return to Work Center. So good morning and good afternoon to those in different time zones. I thought I'd start and just give you a little bit of an overview of what the Return to Work Center is exactly. And then from there, jump into the policy section, go into a little bit on the vaccination side, and then wrap up with some of the insights that you can get from the platform specifically. So just as a reminder for those that aren't familiar with the Return to Work Center, our platform is HIPAA compliant, which is definitely helpful when it's talking about verifying testing and vaccinations and other sensitive data. And the platform is built with the intention of helping keep your employees safe and mitigating the company risk when it comes to COVID exposure in the workplace. So the platform includes a couple key areas, one being the super important kind of cornerstone of a successful return to work program is developing out all your return to office policies. Next is having those testing and vaccination options available to your employees. Third is like that day-to-day management of returning to the workplace. Fourth, really being that communication tool. So sharing out policies for consent, articles for your employees to get knowledgeable on the topics and so forth. And then lastly, giving your teams the insights and dashboards to really unlock the full return decisions and keeping you employees and companies safe. So first and foremost, I will transition right into the policy section. So once you've gone through 650, you've developed your policies, you're ready to upload them, convert those into a PDF, upload them right into the Return to Work Center here. And then at that point, you can decide to share those out with your employees. The nice part is you can share them out by location. So if you do have differing policies based on location, you can share those out here, whether you're going to require consent or just make it available for your employees to view. And then at that point, you can share it out. And then of course, you'll have those audit trails available should you ever need to provide any kind of verification that employee did consent to those policies in the future. So that is really the policy section, super nimble as well. As things change and you need to update policies, you can of course reshare those out and require new consents. So with that, I will now transition over into the vaccination section. So if you're going to require employees to get vaccinated and want to record that proof, super important to do so in a safe manner, keeping this information confidential. So the employee would be able to, within the Sequoia mobile app, go ahead and actually upload their vaccination record. They'd be able to do that by scanning the actual vaccination card. And then at that point, it would trigger off a workflow to the medical record access manager. So once the employee actually submits that fully completed vaccination card, they would get that right here in their inbox, and they would be able to view that vaccination record, decide, does it meet all of our requirements? Are they fully vaccinated? Is everything approved, et cetera? Once they determine that everything looks good, we want to approve that vaccination, click approve. And then at that point, it would show up in your vaccinated employee section, and you'd also have access to see all of your vaccinated employees, being able to drill into them to see specifically their vaccination card if you need to reference it, but also a lot of the employee details that are super important as well. So like, when were they last screened, temperature checks, when did they last come in the office and scan the QR code showing they arrived? And then if you're going to require COVID tests for re-entry, which many of our clients are, and Eva mentioned some of the options available, you can actually have those employees in a very similar manner on a frequent cadence, upload their test results into the system. You can view them and approve those as well. So a very similar process as we already talked about on the vaccination side. And this vaccination module is coming in the next month into our platform. So very exciting development there. And lastly, I'll show you a little bit on the insight side. So as you're collecting a lot of this information, whether it be daily screenings, vaccine verifications, testing, et cetera, having access to see what's going on in your organization is super important. As Jonathan showed early on, we have companies in over 20 countries, almost 140 different cities, and a lot of our clients have multi-locations, as I'm assuming a lot of you do on the phone as well. So being able to see what's going on in your organization when you can't physically be there is super helpful to help make decisions and keep your workplace safe. So you'll have all the dashboards available to see what's going on in your organization, what's happening from a reservations versus a cohorts perspective. And if you're requiring testing, all the testing dashboards to see how many have been requested, what's been completed. One of the very important ones is, do we have any positive cases that we need to be aware of? Put the proper mitigation efforts in place, and of course the reporting. And if you do have a positive case, you'd be able to go right into the contact tracing section, be able to report based on those marked critical, pan that date frame, and actually download reports to see exactly who else was in the office, use that data to help complete different requirements, such as government reporting requirements, workers' comp, et cetera, and also notify any employees via that contact list as well. So great tools that are available for you to utilize. And I'd be happy, as always, if you guys do want to go into any more detail about your specific use case, I was happy to do so later on too. With that, I will turn it right back over to Jonathan.
Thank you, Landon. And thank you, Kimball, as well, for walking through both the 650 solution as well as the Sequoia Return to Work Center. So again, a quick overview from creating a policy, whether mandatory or voluntary from a vaccination policy perspective, all the way through providing an efficient and easy way for employees to adhere to that policy through the Sequoia Return to Work Center and in the Sequoia app, is really about completing the end-to-end process. From generation all the way through to compliance. And so what I'd love to do now is to invite back all of our speakers today and we'll round out our time together with a Q&A as promised throughout this webinar to address a lot of the questions that we've received over the last few weeks, as well as questions that have been asked throughout today. So the first question that I want to ask in Marina's direction is, can you speak to the accommodation obligation? And specifically, is it enough to allow an employee who can't or does not want to be vaccinated to work remote?
Well, it depends on the circumstances. So it's an individualized assessment. And in some circumstances, a reasonable accommodation certainly will be remote work. In other circumstances, remote work will not work, right? If an employee can't perform the essential functions of their job or do it well remotely, then that might not be a reasonable accommodation. Since we've all been at home doing remote work for so long, that's another thing to consider. You know, if a person has been able to effectively work from home over the course of, this last year, for example, it might be difficult for an employer now to say, well, that doesn't work. You can't effectively perform the essential functions of your job from home. So it is certainly one potential reasonable accommodation. There are others. If multiple accommodations are possible, the employer can choose the one that they like best. So if it's either remote work will work, also PPE with an office at the end of the hall will work, the employer can choose the latter over the former.
Wonderful. Specifically, again, Marina, in regards to discrimination for incentivizing the vaccine, are there any potential issues that could arise by incentivizing employees get the vaccine?
It's a good question that somebody asked. I saw a question which was, if you have a voluntary program and you provide incentives, $200 if you get vaccinated or something, but you have certain disabled employees who are unable to get the vaccine, and so they're precluded, they're disqualified from this incentive, could there be a potential discrimination claim? And my answer is, I don't think that you're targeting disabled or any other employees by offering the incentive. So I think it would be difficult to have an intentional discrimination claim. Plus, I expect that there will be more than disabled employees who refuse to get the vaccine. So if it's voluntary, certainly some disabled employees may say they're precluded from getting it. Other disabled employees, because of the nature of their disability, will still opt to get it. And certain employees who have no disability will opt not to get it. So those are all good facts for purposes of, is there a discrimination claim? I could, though, imagine in very particular circumstances, a disparate impact claim where all of the employees opted in, they got the vaccine and they got the incentive, and the only employees who didn't get the vaccine or the incentive are disabled workers. They may say that this facially neutral incentive program has a disparate impact on disabled workers. And what I responded in writing here was that I think to cure that or take care of that issue, you can just go ahead and give the incentive to what hopefully is a small group of employees who are, as a result of a disability, unable to receive the vaccine.
And we've talked a lot about a policy for existing employees, your current population of your organization. Can you talk about what a company or an organization can do from a new hiring practice? Can this be required of an employee onboarding to the organization for the first time?
You could, just as you can mandate the vaccine for existing employees, you can make it a condition of employment. So you can include it in your offer letter or just make clear that it's part of your policy, that just like employees have to provide proof of their eligibility for employment and other issues, maybe they're doing a background check or whatever your conditions are to employment, that they also have to provide proof of vaccination. And to answer another question that came up, it is permissible to ask if employees have been vaccinated and to require proof of vaccination.
Wonderful. Thank you, Marina. Eva, a question for you specifically around COVID testing. Is COVID testing necessary now that the FDA has authorized vaccines?
Yeah, so the way I view testing is that it provides another layer of protection. And as Marina discussed in her slides, is that there are many exceptions and not everyone can can get the vaccine. And also in the short term, there's limited availability for the vaccine. So I think the companies should, should have a test screening program and have that in conjunction with a vaccination to at least provide protection for those who cannot get vaccinated or do not have access to vaccination. Marina, I don't know if you have additional comments.
I don't, not on that issue.
Kimball, a question for you regarding the policy generation. What are the things that 650 considers when creating a template that a policy can be derived from? You mentioned that you work closely with Marina, but what is essentially the approach or the process that is taken, and even the maintenance? How often are these templates maintained when a policy is generated through the 650 tool?
Yeah, really great question. Thank you. So we will comb through the guidance on the issue with the employment team at Wilson Sonsini. So with Marina and with her team, which we really think is the best employment group in the nation. And so we will comb through that guidance, all the federal guidance, all the state guidance, all the local guidance, whatever is applicable. We will then kind of, once we have our minds wrapped around that, we will draft kind of the static parts, basically the parts that won't change, that have to be in that document. All of the disclosures, all the right information you need. And then we'll start to work on the things that will vary. And that's really the most complicated part. So we'll work with Marina and figure out, Marina, what kind of questions do you ask when you're forming this policy? And when how do you ask those questions, and what follow-up questions come from those? And so, here again, the real main pivot point for companies with a vaccine policy is, are you going to make it voluntary or are you going to make it mandatory? And that changes so much about that policy. Whole paragraphs are taken out or added in. There's a whole nother sheet to the document where you want to collect consents and kind of gather some basic information from your employees if it's mandatory, but not if it's voluntary. And so then we plug those aspects that change depending on the company's circumstances into our automation system, so that, again, in the end, it really just walks you through it just like Marina would. Now, as the law changes, we will update the document in real time. So if the EEOC comes out with additional guidance, which easily could happen, we will go back into the document, we'll adjust all of the static portions, the portions that don't change, and then we'll also review the parts that change depending on the company's circumstances to mold them to make sure that they still are in line with the updated guidance. And whenever there's an update, we inform the Sequoia customers in two ways. Number one, we send an email. And so Sequoia customers will get an email whenever the law changes in a way that's material, that's important. And number two is we give you an in-app message. So there will be a pop-up that says, there's been an update. Here's what this update means. And it'll kind of lay out all those details for you. So really, we work with Wilson Sonsini hand in hand, to really try to make this information accessible. That's really the goal of 650, and this is why we've been so excited about our relationship with Sequoia. Again, everybody would love to have Marina on their team, and that's what we're trying to do for any Sequoia customers who want to use it.
Awesome. Thanks, Kimball. Considering a lot of regulations and guidelines that have changed even just over the last 6 months, and this question is for Landon, how does the Sequoia Return to Work Center, or can it navigate tracking and having reporting capabilities to say, okay, in the last 2 weeks, have there been any exposures, or who potentially could have been exposed, or 45 days, an example?
Yeah, great question, Jonathan. So within the platform in our insights section, you have the ability to both, one, if you're doing testing, see who's tested positive and negative through the testing platform that we highlighted, but also within the contact tracing module, if you're aware of a potential positive case or potential kind of situations like that you would want to notify employees, you are actually able to kind of navigate by the employee or critical employees look at that date range that you want to do contact tracing based off of, download those reports, send out notifications, and it can also help when kind of the reporting out there, such as like minor and major outbreaks with Cal OSHA, for example, that would be also possible.
Awesome. Thanks, Landon. And a couple of questions coming in fresh off the presses for Marina. Is there a requirement to post whether or not employees have been vaccinated publicly? Whether it's the number of employees, the percentage of the population of an organization, is there a requirement for that?
There is no such requirement. In fact, I think it's dangerous. Well, it's I think dangerous to publicize who's been vaccinated and who hasn't been vaccinated. I've gotten some questions about, well, can we put a sticker on employee IDs for the people who are vaccinated, for example? So walking around, you know who has and who hasn't. And I think the answer to that is that I would not do that, because now you're giving out information to people. Now everyone can see she's been vaccinated, he hasn't been vaccinated. So there's a potential for harassment, for discrimination, for I don't want to sit near him or her or work with them. And also it might prompt follow-up questions. Well, gosh, you don't have a sticker. Why weren't you vaccinated? So now we're getting into disability issues. So it's information the employer can require that they need to maintain as confidential because it's medical information, but that should not be publicized or shared.
Wonderful. And again, I just want to say thank you to all of our guest presenters today, Marina and Eva from Wilson Sonsini, Kimball from 650, and Landon from the Sequoia team. Again, and all of you who participated and submitted questions. If we didn't get to your question today, we'll be sure to fold it into a future webinar. And we hope you have a wonderful rest of your Thursday. Again, we'll have an additional webinar coming in the month of April that you can check out at sequoia.com/events. And again, together, we truly believe by bringing the community together, we can have a thoughtful and holistic and complete approach to coming back to the office in a safe and healthy way. Thank you, everyone.